Restrictions on childhood vaccines being rolled back. More on the move and what parents need to know. You're watching Morning News Now. We're back with new details about unprecedented changes to childhood vaccines. Yesterday, the Centers for Disease Control announced it is scaling back the immunization schedule for children, recommending all children now get vaccines for 11 diseases rather than 18. The new schedule will now more closely resemble guidelines that are used in Denmark. It breaks up vaccines into 3 categories: vaccines for all children, vaccines for those who are high risk, and vaccines based on shared clinical decision making. That really just means doctors and parents decide together what is best based on a child's health. We have NBC News medical contributor Dr. Natalie Azar here to break it all down for us. Dr. Azar, good morning.
Good morning.
Great to have you with us. So many questions about this. So this went into effect immediately. Yeah. Which vaccines now do fall into this category, which means they are no longer recommended for all children? So going from 18 to 11, what are those 7 in the middle?
Okay, so the 7 in the middle, which actually made things a little bit complicated, they include RSV, hepatitis B, meningococcus. So these are the ones that are recommended, the ones that our viewers can see. This hasn't changed, and this will make a lot of people happy that for MMR and for chickenpox and pneumococcal and polio, that's all still there. The ones that shifted over to you're either getting it if you're high risk or with shared decision making include things like meningococcus, hepatitis A and B, rotavirus, RSV, which really confused people. I think I want to clarify that for folks. The RSV recommendations actually didn't change. But the big one here is flu. Flu, which we used to universally say the CDC recommends a flu shot for everyone 6 months and older. Flu has now been shifted over to the category of shared decision making. Their rationale for this, their argument for this was weak. At best, I should say, we know from years of data that the vast majority of children who die from flu are unvaccinated. So as you can imagine, infectious disease, public health, pediatricians have reacted quite strongly to these changes.
Yeah, absolutely, including the American Academy of Pediatrics describing these changes dangerous and unnecessary. Tell me more about that reaction and the CDC's explanation for doing this.
So I was on the American Academy of Pediatrics call yesterday, and in addition to what you described, one quotation that I had to write down was Dr. O'Leary, who said that this would be humorous if it wasn't so tragic. And especially, again, so sort of sowing this confusion in the midst of a terrible flu season. Their rationale for doing it, Savannah, is to sow more trust in the process. They cited data that since the pandemic, trust in vaccines and in the government and CDC dropped so dramatically, and that they were trying to restore the trust. The data that they use, the science, the literature, the studies that they use to support some of their recommendations have been deemed, inadequate, not really robust, faulty at best. And so, again, what we truly believe is that this is just sort of consistent with an agenda from this HHS to reduce the number of vaccines, to try to sort of, at one point in their documentation, they actually said that maybe it's the vaccines that are part of the reason that we have a chronic disease epidemic in this country. So just nothing that most of us in the medical profession regard as rigorous science and evidence-based recommendations.
I guess, though, to ask a question, because I just mentioned this fact a moment ago, some viewers might be hearing like, okay, well, it doesn't sound bad if we're going to resemble somewhere like Denmark. This is being something similar. This schedule is being used somewhere else. Yeah. I believe successfully. I don't know necessarily the rates of sickness in Denmark for children, but how do you explain something like that? Or for people who are sort of like, I do want less vaccination for my child, and they hear a fact like that, how do you square that?
The explanation that we have are sort of, to us, it really is like comparing apples and oranges. Comparing our United States to a country like Denmark that has a vastly different medical and health and public health infrastructure, universal health care, amazing preventive care, so that if children develop a childhood illness that is vaccine preventable, there is care for them. That's not the case here in this country.
That's a great point.
We know that there are millions of children who don't have health insurance. And so for people like that, for children in our country, vaccination is at a minimum an initial layer of protection. And so that's why it's like you can't compare. We, in this country, with the Advisory Committee on Immunization Practices, every single year, they re-look at the vaccine schedule. And there is input from experts. There was no input from experts. This was all done independently from RFK's handpicked crew, who are currently the head of CDC and the FDA and all of that.
Practically speaking, what does this mean? Parents can do, should do, are able to do?
Okay. The number one thing is please have a conversation with your pediatrician. In all likelihood, they will have a conversation with you and say, for example, with rotavirus, a vaccine that they are now saying is one for shared decision making. Without vaccination, 50 to 60 children die every year. That data alone should be enough for parents to say, why would I do that? I'm going to vaccinate my kids. So that's really my message to folks, is to please have a conversation with your pediatrician. These vaccines should still be covered. We were reassured that would be the case.
By insurance.
By insurance. But, with insurance.
We'll keep an eye on that. Yeah.
Exactly.
Dr. Azar, thank you so much. We'll see you next hour.
Okay.
Well, moving from